My name is Emma and I'm going to give you an overview of the doctor's worklist and how to navigate and use it. The worklist can provide a snapshot into the patient's condition and provides functionality to quick access for forms and documentation. We suggest that the doctor's worklist is set to your landing page when logging into PowerChart, and you can do this through My Experience within the blue menu at the top left-hand side of your screen. The doctor's worklist contains many columns and we suggest that you customise it to what works for you and your team. Remember, this is only an individual option and each team member will have to do it separately. You can do this by navigating to the three lines in your right hand corner and then clicking onto Layout Configuration. Here you can see the entire list of options for your columns, and you can tick or untick columns as you want or to have them included or not included within your work list. You can also click into each column and drag so you can rearrange your column as you need it to. You can also customize your rows to see increased width for each patient, so you can see a greater or lesser amount of clinical information just by looking at it rather than clicking into each column. And any changes that you make, please click Apply, which changes your work list. Clicking into the patient column, not on the patient's name, which takes you directly to the record, but actually in the column, opens up a screen containing information about what care teams the patient is linked to, clinical data, which shows you vital signs, lab results, any current medications, and the patient's fluid balance if recorded, then also iPass. Now, iPass allows you to set actions both for yourself and your teams. But please remember, this doesn't form part of the permanent patient record, but instead works as a communication or handover tool. And here you can write your task in the task column, and then it shows you a tick box, which then you can tick as completed, and also shows in the action column on the work list itself. In the task column shows you the outstanding medical tasks, which you can document straight from the work list. And you can also add a free text comment to your team as a communication. You can see the latest documentation that has been documented within the patient record, as for example, this patient's had a discharge progress update and ward round notes documented. You can also, using the create button, create a discharge progress update, which you do in your ward or board rounds, a respect plan, ward round note or progress note. In the notifications column, you can see any results that need to be endorsed, and you can do that from here. You can see any labs within here and also open the chart into the patient record that takes you straight through to the recent results. You can see the latest EWS score, and you can also see if a patient is at risk of sepsis. Then within this, you can actually open the chart to then order the sepsis care plan, or you can open the de-escalation form to stop any alerts if it's a known ORT or a not a diagnosis of sepsis. In the escalation of treatment column, you can see what's been recorded within the respect plan. As you can see, this patient is for inventive deterioration, is for MET calls, and you can open your form from this. And also in the resuscitation column, you can see whether this patient is for resus or not. You can also see the high risk that tend to be from the nursing tasks and the nursing assessments. You can see things like Braden score or a MUS score within here, and the results from this and the time that they were assessed. If you require further support with the content of this video, please contact either the digital division or a physician associate within your team. Many thanks.